Hello, my name's Alex Holmes and I'm the Macmillan Cancer Information Manager at Barking, Havering and Redbridge University NHS Trust. Welcome to Empower, our health and wellbeing information film. You should have received a booklet that will complement the information that we will be giving you today. Please remember that some of this information was written pre-COVID pandemic and current social distancing guidelines. You will have also been asked to book into a video consultation in a couple of weeks' time. This will be a group session where you can meet other people who have been newly diagnosed and have the opportunity to ask us other questions.
Hello, my name is Lucy Brooks and I'm the Living With and Beyond Cancer Lead at the Trust. We're going to cover the following topics in this information video: eating well, managing side effects, physical activity, an overview of the treatments offered to you, your well-being, the emotional impact, and the resources that we have available for you at BHRUT.
Hello, my name is Gemma O'Reilly and I'm lead cancer nurse here at BHRUT. And I'm going to give you an overview of some of the treatments that you might be offered. Today we will talk specifically about surgery, chemotherapy, radiotherapy and hormonal treatment. Your treatment will be offered to you based on the type and stage of your cancer. Everybody's treatment plan is individually planned at one of our MDT meetings, so please be careful about comparing to somebody you know that might have had the similar cancer to you. If you do have any questions, please speak to your CNS or to your doctor regarding your treatment plan. At BHRUT, we promote patient empowerment. We want you to understand not only what treatment you're having, but why you're having it and why that treatment we feel will be best for you. So if you have any information you would like to discuss, please bring it in with you to your appointment. Today I'm going to talk to you about the surgical side of your treatment. Surgery is what we call a targeted treatment. It means that there's a specific area that your surgeon feels that they can remove. This might be to cure your cancer, or it might be to relieve some of your symptoms before you go on to further treatment. For your surgery, you will meet with your surgeon, and often your CNS, your key worker or your Macmillan nurse, they go by all those names, will be there with you. They will talk to you about what surgery you're going to have and how and when it will happen. That is your opportunity to ask your surgeon any questions that might occur. But afterwards, if you think of anything else, you can always talk to your CNS or your Macmillan nurse again. During that consultation, you're going to be consented for the surgery. Your doctor will go through all of the possible side effects as well as some of the risks that can occur following surgery. At that point, they might ask you to sign the form, or they might send you away some information. You sign the form on the day. This is just a legal parameter that we have to meet. At any point, you can withdraw your consent if you change your mind. And if you do have any further questions, please contact your relevant nurses. Before your surgery, you will meet our pre-assessment team. Their job is to work with the anaesthetist, who is the doctor that puts you to sleep. They will ask you some more questions about your general health, and they may want to do some further checks. For example, if you've had asthma, they might want to do a lung check to make sure that your lungs will be safe while you go to sleep. You will also have a further swab, an MRSA swab, to make sure that you're infection clear before you come in for your surgery. Most of our surgeries are done here at BHRUT, either at Queen's Hospital or at King George's. But for some of our speciality surgeries, we send you into London, into either the Barts Hospital or the UCLH. This is to ensure that the surgeons doing your surgery have more experience at your specific type. For those types of surgeries, you will be sent to the respective centres and you'll meet the teams beforehand. You will sit down with both their nurses and their pre-assessment teams, and they will go through your treatment in further detail with you at that point. After your surgery, people's biggest concern is normally the pain that they might experience. Any surgery should leave you to be a little bit uncomfortable, but we don't want you in pain. You'll be talked to about the type of painkillers you'll be offered following your surgery, but it is important if you are experiencing pain to let the nurses know. Depending on the size of your surgery, you might have regular painkillers, or you may be given a morphine pump that you work yourself, or you may be given some painkillers directly into your back called an epidural. This will be discussed with you by your anaesthetist. However, again, if you are in pain, you must let the nurses know on the ward. We can't help if we don't know. When you wake up, you might have some tubes. Sometimes you'll have some in your arm to give you fluids. You might have a catheter in for a number of days. The catheter is there to make sure we can monitor your urine output, which is one of the key signs if you're starting to become unwell. This normally comes out after you get up and mobilise. If you're having a bladder or a urology operation, it may be in for a bit longer, and again your nurses will talk to you about that. You may have a drain in. A drain is a tube that goes into an area of your body, and the job is to drain away any excess fluid. Without this drain, pockets of collection can form which can become infected. Often these come out within 48 hours of your operation, but occasionally we'll leave them in a little bit longer and we send you home with them, particularly if you're having a breast operation. Your nurses are there to support you in the community and will be able to help you look after them. We do not send anybody home unless they are comfortable with looking after their drains or their wounds. One of the risks following an operation is a blood clot. You can get one in your leg or on your chest, and these are called a DVT or a PE. To help nullify this risk, we will give you some lovely stockings to wear while you're in hospital. We'll also give you an injection into your tummy to thin your blood slightly. Sometimes, if you've had a larger operation, you will go home on this injection for a few days, but again we will support you going home with this. There is a risk following surgery of minor infections, the most common being a wound infection. Your nurses that will be looking after your dressings will be using aseptic technique to do so, and you will be sent home with information going forward on wound care. The other risk of infection is your chest. Often when you're lying in bed, your lungs don't expand as much as they should, so we encourage you to get out of bed as soon as possible, walk around the ward, and you will see physiotherapists to ensure that you're doing the exercises you need to do. We know that this is a scary time coming into hospital for your surgery, but we hope that you will have a good experience like many of our patients before. The biggest thing you can do to help yourself is ask. If in doubt, speak to your CNS or the nurses on the ward. We are here to help.
Hello, my name's Louise Dan. I'm one of the clinical nurse specialists here at Queen's Hospital, and I'm here to talk to you briefly about radiotherapy. Radiotherapy may be one of the chosen cancer treatments that you're due to embark on here at Queen's Hospital. Radiotherapy are external beams of light that are directed to specific targeted areas of your body. Now, these external beams of light are painless, and it tells you laying on a bed like the one in the picture for a very short period of time. As radiotherapy is a cancer treatment that may come with side effects, you will require to be seen by a medical oncology consultant who will go through the specific side effects for your particular treatment, and you'll be required to sign a consent form. Prior to your radiotherapy treatment, you'll be asked to come in to have a planning CT scan, and this is in order that your radiotherapy treatment will be specific and targeted and very precise. You may be asked to have what's called tiny tattoo markers or seed markers given in order to make the radiotherapy in the same position every single time you come in. You may also hear radiotherapy spoken to in terms of fractions. These are the daily treatments that you'll be given. For example, Monday to Friday are fractions every day. So radiotherapy department is based here at Queen's Hospital, and our opening hours are Monday to Friday, 8 AM to 8 PM. Prior to starting your radiotherapy treatment, you will be given an itinerary of times and dates that you are expected to attend. Now, these are not always set in stone and can be flexible, and some people may have a preference for AM or PM, and things can be negotiated so in order to keep your life as normal as possible. Radiotherapy for most things are done here at Queen's Hospital. However, gynecology radiotherapy is done at St Bart's Hospital at the moment. So this is just a general overview of radiotherapy, but if you have any specific questions related to your own particular cancer treatment, you can ask your medical oncologist or one of your own assigned clinical nurse specialists. Thank you for listening.
My name is Gaynor Fowler. I'm one of the breast care nurses based at King George Hospital, and I'm going to give a brief overview of chemotherapy. Chemotherapy is a systemic treatment. By that we mean it's either given intravenously or in tablet form and enters the bloodstream to be travelling around the body. We do have targeted therapies that are very clever in actually delivering the chemotherapy to the site where we want treatment to be given. Patients have to sign a consent form. The consultant will have to explain the treatment to you, the rationale why you're having this treatment, and explain the side effects. And then you sign a consent to say that you're happy to proceed. You will have a pre-chemotherapy chat. That's a one-to-one session with the nurse on the day of your first treatment. And again, they will go through those side effects with you to make sure that you understand what will be happening. Treatment is given in regimens, either single drugs or combination of drugs, and again that will be discussed with you by your doctor and again your nurse. The length of time between each cycle varies depending on what the drug is being used for. Chemotherapy is currently being given on the Sunflower Suite here at Queen's Hospital and at the Hartswood Hospital in Brentwood. The Sunflower Suite is open Monday to Friday 8 AM to 8 PM and the Hartswood Hospital 8 AM to 4 PM, again Monday to Friday. There are a whole host of potential side effects. Please see the word cloud on the next slide of this presentation, and more of an explanation of those side effects will be in the accompanying booklet. Please remember though, these are potential side effects. You are unlikely to experience them all. You will be given contact details of a 24-hour emergency helpline. Please do call this number anytime, day or night, and particularly if you have a temperature that's over 38 degrees centigrade. Again, the doctor and the nurse will explain the reason why you need to do this. You'll have a review with either a doctor or a chemotherapy nurse before each cycle of treatment, just to make sure that you're well enough to proceed to the next cycle and to discuss with you if you've had any unwarranted side effects that need addressing. You will also need to have a blood test done before each treatment, again to see that your body has recovered and is fit enough to proceed on to the next treatment.
The treatments we have covered will all have their own side effects, like any procedure or medication. Please remember that these are potential side effects and you may not experience them. Before you sign a consent for any treatment, the doctor, whether that be the consultant or their registrar, will explain the side effects for your specific treatment may cause. Most side effects can be reduced or controlled with drugs or some simple tips we have listed in the booklet. If you experience any side effects, please do not sit at home worrying or suffering. You'll be given contact details to ring, so please do so. Especially if you're having chemotherapy. Remember that Gaynor mentioned the 24-hour emergency helpline number. There's someone at the end of that phone 24 hours a day, 7 days a week, and no question is a silly question. Any specific questions or concerns you have about side effects, please jot them down and ask us at the video consultation. So now we're going to talk about healthy eating and the benefits of having a good diet. We know that maintaining your weight and having good nutritional status is so important while you're going through cancer treatment. Your chemotherapy and radiotherapy doses and treatment are worked out on your body mass, so we don't want you losing a lot of weight or putting a lot of weight on. And your cells need a good nutritional status to be able to repair the damage that's caused by various treatments. But we know there are a lot of reasons why you might not be wanting to eat at this particular moment. Anxiety, that just having the diagnosis of cancer may cause you to comfort eat or not eat at all. Also, where the cancer is may be causing problems in eating and drinking. If it's in your food pipe or in your stomach and bowel, there may be certain foods that you can't tolerate. Sometimes the treatment causes your taste changes and this puts you off eating as well. And then there's the social aspect of eating. We sit down to dinner to eat together, and if you don't feel like eating, you may not want to do this. So what constitutes a healthy diet? As you can see from the diagram, a third of your plate should be fruit and vegetables. That's 5 portions of fruit and veg a day. That doesn't mean 5 bananas, but maybe some satsumas, a portion of grapes, berries, some broccoli, carrots. As you can see from the diagram, we would encourage you to eat the rainbow, because we know if you get a variety of different colours, you'll get a variety of different minerals and vitamins too. The next portion is your carbohydrates and your starchy food. So things like your pastas, your rice, your potato. And then protein is a smaller bit. Protein, if you're a meat eater, of course, is your meat, your red meat, white meat, fish. If you're a vegetarian or a vegan, you would get this from your pulses and seeds. And then the small section is our dairy intake. So obviously, if you have dairy products, then you limit the amount of dairy that you have, maybe look at different substitutes. And if you don't eat dairy products, then make sure that your plant-based milks like almond milk or hazelnut milk have got calcium added because we do need calcium to protect our bones. And then a tiny little section of oils and fats because we do need this in a healthy diet as well. We thought it might be a good idea to try and dispel some myths that you might have heard. You may have experienced some well-meaning family members or friends who are giving you some ideas about what's best for you to eat, or you may have been doing some research yourself. And at this point I should mention we don't recommend that you look at Dr. Google because you have no idea where that information is coming from. So the first on the list is sugar. You may have heard sugar feeds cancer. You should get rid of sugar from your diet. There is no evidence to show that this is true. All our cells need some energy to be able to replicate themselves. And cancer cells use sugar as normal cells do too. But it's not causing the cancer and it's not increasing the cancer. But all of us in a healthy diet should reduce the amount of sugar that we take. And there are hidden sugars in things like tomato ketchup, baked beans, even some healthy cereals. When you look at the packet, sugar will be high in their content. So try and reduce this by getting baked beans with reduced sugar and salt, and look for alternatives, but don't exclude sugar from your diet completely. Next on the list is dairy. You may have heard some concerns about having dairy in your diet. There is no evidence to show that they're linking dairy and cancer. There is a perceived link with breast cancer that due to the hormones given to cows, that this is excreted into the milk. There is no evidence to show that this passes down the food chain. Milk and dairy products are, however, a good source of protein and calcium. Calcium is good for your bone strength and can help counter the effects of steroids during cancer treatment. Meat. Now, there is some evidence to show that eating red and processed meats can increase the risk of some bowel and stomach cancers. This research has been done in places like South Africa and Australia where they eat a lot of red meat, especially barbecued meat, and it seems to be some link with cooking meat at a high temperature. The UK government advised reducing both red and processed meat to 70 grams per day per person. Now, red meats include beef, lamb, pork, veal, goat. Processed meats include things like sausages, beef burgers, and any meat that has been smoked or cured or had salts or chemical preservatives added to them, such as hams, bacon and salami. We're not saying never have any of these, but have them as a treat. Now, white meats such as chicken, turkey and fish are safe to eat. And all of us should be having a meat-free meal at least once or twice a week. But there is no need for you to follow a vegan diet unless you choose to do so. Now we come to organic. It's not necessary if you're washing fruit and vegetables to have an organic diet. And we know that organic food is expensive, but it is a personal choice. Some people ask us about vitamin supplements. If you're having a healthy diet, then it's unnecessary to take vitamin supplements unless you've been told you're deficient and you're being prescribed the vitamin to take. This is because the body can only store the amount of vitamins we need and will just excrete them, so you might as well just chuck them down the toilet. There's not enough evidence to suggest that high-dose supplements can help treat cancer. And in fact, some supplements may interact with cancer treatments. So please tell your doctor if you're taking any non-prescribed medication, including vitamin supplements. And on a similar theme, we're talking about herbal or homeopathic remedies. Again, if you're taking any herbal or homeopathic remedies, please tell your doctor if you're taking any, because we need to make sure they don't interact with your treatment. For instance, we know that St. John's wort can interfere with chemotherapy, so we would definitely not be allowing you to have that. A lot of people ask us about turmeric. There is some thought that turmeric may have some anti-cancer properties. Again, there's no evidence to show that this is true. A lot of people ask us about cannabis and cannabis oil. Cannabis oil is this type that you can buy from your local health food shop and is not illegal to take. Obviously, the other type of cannabis is illegal, but we do know that a lot of patients source it because they feel that it has anti-cancer properties and will help them. There is no evidence at the moment to show that this is true, but we do know there's a lot of research going on. Please be careful if you are sourcing cannabis because you don't know where it comes from. And please, if you are taking it, do tell your doctor because it will have its own side effects. Next on the list is probiotics. Now this is the live bacteria that you can get in some yogurts like Yakult or Actimel. We would recommend if you're having chemotherapy not to take probiotic yogurts because we don't want to add live bacteria into your body when your immune system isn't working to its full extent. But if you're not having chemotherapy and you're having radiotherapy and you're getting radiotherapy-induced diarrhoea, then actually probiotics can help by reintroducing that live bacteria into your gut. Now, who's heard about superfoods? Well, unfortunately, there is no such thing as a superfood. It is a marketing ploy. So all that broccoli, goji berries, blueberries, all those types of food, what we do know is that they're really good for us because they're bursting with vitamins and fibre and iron, so they're good to take, but they don't have any anti-cancer properties. Alcohol. Funnily enough, we get asked about alcohol a lot. Now, a large consumption of alcohol has been linked to many cancers, including breast, bowel, liver, throat, mouth, and some esophageal food pipe cancers. The government guidelines are a maximum of 14 units a week and have as many alcohol-free days as possible. But while you're having treatment, it is okay to have the occasional glass of wine or pint of beer, but you may find that you become a bit of a cheap date because you don't actually fancy it. And last on the list is the alkaline diet. This is a big no if anybody mentions the alkaline diet to you. It was devised by a professor in America who's actually serving a prison sentence and facing a big lawsuit. It's a very restrictive diet based on the theory that we can turn the body alkaline, which is impossible. There is no link between eating acidic foods and cancer. So we thought it would be a good idea to give you some top tips about what to have during treatment. And the majority of this information can be found in this useful book, Food and Cancer, What's the Deal?, from the Trekstock charity. So loss of appetite and worried about losing weight. What can you do to counter this? Make the most of your meals when you feel well enough to eat. We would recommend you eat a little and often, having high-calorie snacks frequently throughout the day rather than trying to face 3 big meals a day. Then there are tips by adding whole milk or full-fat cream to nourishing soups and drinks and casseroles, or trying some skimmed milk powder. You can get this in your bakery aisle in the supermarket because that will add calories and protein without adding bulk to your food. Some treatments can cause a nasty taste change and make food taste different. Some people described it as tasting like cardboard or metally. And you may find that foods and drinks that you really loved, you just can't tolerate, like tea and coffee. And it can become quite expensive. You might fancy something one day, say strawberry yoghurt, you buy a whole fridge full of strawberry yoghurt and you can't bear it the next day. So tips to try and counteract this taste change would be to add lots of spices and herbs to food. It may be over the top to other people, but just to get some taste for you. If you have a metally taste in your mouth, avoid red meat and switch to white meat or fish. Try avoiding metal cutlery may help as well. Sucking on sugar-free sweets such as mints or lemon drops to stimulate your saliva. And some people swear by fresh pineapple as it has an enzyme that will stimulate your saliva and clean your mouth. Ask about mouthwashes, non-alcohol based ones, and brush your teeth or use mouthwash before food. Now, one side effect, especially of chemotherapy, can be nausea, and it can be difficult to think about food if you're feeling nauseous or have no appetite. So it might be helpful to start thinking of food as medication, something you need for your body to repair itself. Take your anti-sickness tablets before you get out of bed in the morning and stay in bed for 15 minutes. And then take them 30 minutes before eating and try not to lie down for 30 or 40 minutes after food. Try to avoid having an empty tummy, as this can make you feel worse, so nibble on a biscuit or a dry piece of toast. You may find that cooking smells affect the nausea, so avoid the kitchen if you can, or have cold foods for a while. They may even be easier to eat. There are lots of hints from patients who have helped them, like using ginger or ginger tea, ginger cake, crystallised ginger or peppermint tea. Fizzy drinks that aren't too fizzy can help too. And some people use those sea bands that are for seasickness, that might help too. Now, bowel issues, you may be suffering from constipation. Drink plenty of fluids, eat regularly, and increase, if you can, the fibre in your diet, unless you've been told to restrict fibre. Gentle movement may help, and some people say a hot drink will get things moving. If you're having problems with diarrhoea, again, keep your fluid intake up because you need to replace that fluid that you're losing. Avoid rich foods, eat plain, starchy food, and avoid too many fibre-rich foods such as raw fruits and vegetables. If you're experiencing any of the above, it's important to let your team know, especially if you're on chemotherapy or radiotherapy. And especially if you're having diarrhoea more than 4 times a day, please do phone that 24-hour helpline number. The term neutropenia is the term we use if your white count, your infection-fighting cells, drops during chemotherapy. Before you start chemotherapy, you'll be given information about what certain foods we would recommend to avoid during this time. Use good hygiene when handling food. Wash your hands when preparing food and wash fruit and vegetables. If you're going to be reheating food, please make sure that it's piping hot before you eat it and that the food has been stored previously in the fridge. If you have any concerns about your diet and food intake, you can be referred to a dietitian. Please ask your clinical nurse specialist or doctor to do this referral.
So now we're going to talk about the benefits of physical activity. There is lots of evidence to show the benefit of exercise for our health and also to improve outcomes for cancer patients going through treatment. The evidence shows that engaging in moderate to high intensity exercise has the best impact on improving health and some symptoms from cancer treatment. Exercise not only impacts our physical functioning, including cardiovascular function, muscle strength and flexibility, but also feelings of anxiety and depression, cancer-related fatigue, and our overall quality of health. When we exercise, our body releases hormones called endorphins, which are otherwise known as our happy hormones, which give us that sense of joy and achievement, helping us to combat feelings of low mood, which can be very common following a cancer diagnosis. Current recommendations for an adult are that we should aim for 150 minutes of moderate intensity activity per week, which is equal to 30 minutes a day, 5 days a week. This means that we should feel just a little bit warm, slightly breathless, still able to talk but not sing. We should also try to incorporate 2 sessions of strength training per week. This can be something simple like lifting a 500ml bottle of water, or carrying the ironing basket, or a heavy shopping bag. If you're lifting a small weight or water bottle, you should aim to do 3 sets of 10, or keep going until you feel like you can't lift the next one. If you're new to exercise, 30 minutes may be too much all in one go, so you can break it down into 3 lots of 10-minute sessions a day, or 2 15-minute sessions to suit your level. Gradually build your tolerance up over time. So when is it okay to be active? You can engage in physical activity at any stage following your diagnosis. Preparing your body before surgery or treatment is highly recommended, as it will improve your cardiovascular health and muscle strength, therefore enhance your recovery and ability to resume normal activities more quickly after surgery and treatment, and also your tolerance of some treatments. While you are having chemotherapy or radiotherapy, it is perfectly safe to maintain your usual activity levels if you can, and this can help combat one of the most common side effects of cancer treatment, fatigue. As an occupational therapist by background, I have experience in helping people manage fatigue and have some tips on how to help work through this. When on cancer treatment, you will find that you have good days and bad days. It can be very tempting when you're having a good day to try and get all your jobs done and be very active and do everything. This is what's called boom, having a boom day. The following day, you will feel that your energy levels have significantly dropped and you are unable to achieve as much as you did the day before. This can also start to affect your mood. The day after that, your energy levels drop even further until you reach the point of total exhaustion and are unable to do anything at all, and this is known as bust. In order to avoid this cycle of boom and bust, the best idea is to make sure that you really pace your activities. So when you're having a good day, avoid that urge to do everything. Balance activity with a bit of rest and don't overdo it to conserve some energy. Then the next day you'll find that you're able to do a little bit more. While on treatment, you will experience some bad days where you can't do much at all. Please don't feel disheartened. Just make sure that the next day you get up, get yourself out for a little gentle walk, and you will start to find that your energy levels will return to a more normal level. Macmillan have a really useful booklet called Coping with Fatigue that can help you manage your fatigue levels by planning out your day and working out what activities you can fit into a usual day. They also have a good online program called Restore, which can help you manage your fatigue. Ask us for more information in your video consultation. When getting started with physical activity, it is important to set yourself goals and start small. Achieving something is far better than achieving nothing or doing too much. For example, if you go out for a mile run, if you've never run before, it's not advisable as you won't enjoy it and you'd probably never return to it. However, if running is something you want to try, simply try and aim for the first lamppost. If you achieve that easily, see if you can get to the next one, rather than setting a goal of a certain distance. Gradually build up the duration or intensity of the activity, and it can be good to keep a record of what you've achieved. Make sure the activity you choose is enjoyable and fun. If possible, include others to help motivate you. Physical activity does not have to be about traditional exercise in a gym. Try different activities. There may be something familiar to you like gardening, housework, walking the dog, or a sport that you enjoy. One great tip is to simply go for a walk. It's a great way to introduce activity into your lifestyle without having to buy any special equipment or subscribing to a gym. You can simply put on a comfortable pair of shoes or trainers and step outside the front door to get started. If you have internet access at home, there are many home-based exercise programs you can access on sites such as YouTube. Alternatively, the Macmillan Move More pack has got lots of great resources to help you get started. This can be downloaded from the Macmillan website, or you can ask us to send you a copy when you attend your video appointment. There are also lots of resources available in the local community, including Walk for Health schemes and cancer exercise referral programs at some local gyms. Ask us for more details at your appointment. Please note that swimming is not advised when on chemotherapy and radiotherapy due to the risk of infection and skin irritation, but it is perfectly fine when treatment has ended.
It's natural to have many different thoughts and feelings and concerns after a cancer diagnosis. You may experience sudden changes in your mood and feelings. These are all part of the process which many people go through when dealing with an illness. There is no right or wrong way for how you feel. You'll cope with things in your own way. It's okay to be worried or upset about things, and it's okay to cry and say when things are getting difficult. It's perfectly normal to feel these and experience these different feelings and emotions. But these emotions may be difficult for you and people close to you to deal with. You may find that some feelings pass with time, while others stay and last longer. Some people describe this as being on a roller coaster, up and down one day and the next. And family and friends experience this too. So how can we look after our mental well-being? Well, we know that by eating well, by getting those good nutritional intake, it will naturally make us feel better. Exercise, physical activity, as Lucy mentioned earlier, it produces our happy hormones and makes us feel better. Maybe this is the time, if you're a bit of a doer, to stop doing everything that you normally do, and it's a time to delegate, which I know is difficult to do. Does it really matter that you haven't done that dusting for a day? You can take control, because that's what people say, it's that loss of control that can be the hardest thing to cope with. Take control by giving your family and friends jobs to do. They will be wanting to help, they'll be desperate to help, but often don't know how to. You may find that you're being asked lots of questions by family and friends about how you are and how you're managing. And this is lovely because they care and they want to understand. But it also can be very difficult for you to manage if you're talking about, you may get phoned 4 or 5 times a day and being asked the same question. Well, I can give you some tips that other people have suggested. And maybe have a WhatsApp group. So you send out a message once a week to say how you are once you've been to the hospital or had a scan result. Some people do it via email, or they have that go-to person, so people aren't asking you, but that person who comes with you. We're not very good about talking about how we're feeling, but it's really important to express your feelings. Don't bottle them up. Find somebody, maybe somebody who's not emotionally attached to you, to talk to if you're worried about upsetting your family and friends. That could be another friend, or it could be your clinical nurse specialist or your doctor, but it's very important to express how you're feeling. It's also important to look forward to doing something nice, possibly once a day if you can. Something as little as reading a book, watching a favourite television programme, or listening to some music. Time to yourself to do your favourite thing. Now, sleep is very important for our mental well-being, and I realise that sleep may be something that's difficult at this moment in time. I can imagine that maybe you've been awake 2 or 3 o'clock in the morning with your mind whirling, and it can be the loneliest place in the world. So some tips to help sleep better. Maybe having an uncluttered bedroom, a nice cool temperature. Don't have the television on to go to sleep. It's an idea not to have your phone or your tablet next to you because there's a blue light that can be excreted that can interfere with your sleep pattern. Maybe listen to some music or some meditation before you drop off to sleep. Then there's the good old wives' tales about, lavender in the bedroom, having a warm milky drink, no caffeine, a nice warm bath that can help you wind down at the end of the day. If you find that you are waking up during the night and you have those worries and concerns or your list of shopping that you need to do, keep a pen and paper by the side of your bed. Write down the list and then it's out of your mind and hopefully you can get back to sleep. If you can't sleep, then it's a good idea to get up out of bed and go into a different room. Lying awake and tossing and turning in your bed will make your bed associated with not sleeping. Make a hot milky drink, turn on the telly, until you feel sleepy, and then go back to bed. And also, we're just giving you permission now to say that it is okay to cry. It can be a good release of your emotions, and it's not a weakness. You don't have to do it in front of anybody, but it's okay to do. If you're finding your emotions difficult to cope with, what can you do to help? A lot of people don't like to talk about their cancer and how it's affecting them, but talking to someone about how you feel can really help. It makes you feel more supported. It can help you understand your feelings and to recognise that these feelings are normal and put things into perspective. As I said earlier, you may not want to talk to someone in your family or circle of friends. So talk to your clinical nurse specialist or your consultant or any of the healthcare professionals you come into contact about how you're feeling and see who they can refer you on to. They may be able to refer you on to our team of psychologists. At this time, it's all telephone consultation for counselling. We also have a team of complementary therapists who will be able to talk to you over the phone and arrange for aromatherapy remedies to be sent out to you in the post. You may have heard of mindfulness. It's very popular at the moment. It's an ancient form of meditation. It's good for reducing stress and anxiety. It's about acknowledging thoughts but not judging them and being aware of the present and focusing on what's happening at this moment. There's a link to a mindfulness resources in the booklet that we sent you. Now, there is nothing better than finding peer support, people who've been going through the same situation as you. At this time, most support groups are being done virtually, so please ask your clinical nurse specialist for more information about this. And we have our team of chaplains who are available to you. There may be a group of healthcare professionals that you weren't aware of, or have never thought about talking to. They're for people with faith or without faith, but they're there to have time to come and listen to you. And please think about your own faith leaders as well. And Macmillan and other charities have lots of resources available online, and we recommend some websites in the back of the booklet. So the W in Empower is about your welfare and some practical issues. So the first thing to think about is the coronavirus pandemic. As you know, the guidelines are changing constantly. So on the end of this film, we have put up the government website for you to check on any current guidelines. Think about some practical issues if you're going to be in hospital or off your feet for a while. Shopping. Can you get somebody else to do the shopping for you, or do some internet shopping and deliveries? And think about planning your meals in advance so you have food in the cupboard ready. It's also thinking about things like your pets in the house or plants. You may have a big garden, a greenhouse, an allotment. Is there somebody else that can look after that if you're not feeling up to it? And if you have pets in the house, then please do let us know, because there may be some considerations we need to make. Also, if you have a dog to walk, is there somebody else that can walk the dog, enter the cat litter tray and things like that? I'm going to talk about children for a couple of reasons. First of all, the practical reasons. It may be that you pick up children from school or you look after children during the holidays. Just think about if there are days that you're not going to be feeling well to do this. Is there somebody else that can do that for you? And then talking to children. A lot of people are concerned about what they say to children and how much they say to children. And also, a 3-year-old would need to know something very different to a 13-year-old. You know your own children, but children are not silly. They do know that something different is happening, and there are whispered conversations that they know that's going on. So please have a look at the Macmillan book about talking to teenagers and children. And also there's a really good little animated film by the Fruit Fly Collective, and we've got flyers that we can give you about that. Work. Now, you may be concerned about work because obviously if you're not working, you may not be paid. Under the Equality Act, a cancer diagnosis is considered a disability, so your employer must make a reasonable adjustment for you. So I would have an open and honest conversation as much as you can with your employer about how much time you may need off work and any adjustments they may need to take into place in your workplace. You should know what your current company's sick pay policy is, because it may be that you only get 4 weeks pay, and then there's a consideration about going into statutory sick pay. Again, as we mentioned earlier, we do have a welfare officer if you're worried and concerned about money. The Equality Act also covers your carer or next of kin. So if your company has a carer's leave policy, I would get them to check this, because it may be they're allowed some time off. It may be unpaid, but time off to help you out. And smoking. Obviously, we advise you to stop smoking if possible. We know this is a difficult time to try this, but we know that smoking is not good for us, and it's not good for cells trying to recover from the chemotherapy. There is advice available from smoking cessation services, so please access these.
We know that having a cancer diagnosis can impact on your finances. If you need advice or support, we can arrange for you to contact our welfare benefits advisor, Ray Wood. He can provide advice on benefits you may be entitled to, debt management, letters to mortgage companies and your employers. Ray is currently running a telephone consultation service 3 days a week. Please ask us at the video consultation for details on how to contact him. Travel insurance can also be impacted by having a cancer diagnosis. If and when we are able to travel abroad, you will need to check your travel insurance documents and inform the company that you now have a cancer diagnosis. You may well find that your premium is increased, so it's therefore best to shop around and speak to individual companies. Don't do a comparison research on something like Compare the Market, because they won't take your individual needs into account. Speak to the different providers. Macmillan have an online travel blog of companies that patients have recently found helpful and reasonable, so it may be a good idea to look on their website. You will now be entitled to free prescriptions for 5 years following your cancer diagnosis. If you are under the age of 60, you should have had a form from your clinical nurse specialist. If you haven't received this yet, please ask them, or you may be able to get this from your GP. This form, once filled out, will entitle you to free prescriptions. Macmillan also provide means-tested grants up to the value of £400 for something that has affected you directly related to your cancer. So, for example, it may be that you've lost a lot of weight and you need to buy new clothes. It may be that your heating bills are high because you're feeling the cold all the time and having the heating on constantly. The grant won't cover mortgage or rent, but it's worth asking us if it's something that you are entitled to. When coming for an appointment at Queen's Hospital, there is a separate oncology car park. When you arrive, please follow the orange signs that lead you round to the oncology car park. Do not park in the multi-storey car park. Drive past the hospital building and turn left where the emergency ambulances go, and you will see the car park at the end. When driving out, please remember to turn right out of this car park. Do not turn left, as the council have installed cameras and will fine you for exiting the hospital grounds this way.
We also wanted to let you know what resources were available for you within the Trust and out in the community. So as a Living With and Beyond Cancer team, we produce a bi-monthly newsletter called The Bridge, and this outlines all our support services. You'll get one in your chemotherapy pack and in your radiotherapy pack, and they're available in the departments as well. Please ask your clinical nurse specialist for it. It will give you our contact details for our Macmillan Information Service, for Ray Wood, our welfare advisor, for our complementary therapy service, and currently for those virtual support groups that are being held, such as Look Good, Feel Better and the Hope programme. And in the back of the booklet we sent you, you'll find a list of resources that are available for you within the Trust. So your oncologist, your haematologist, nurses, therapeutic radiographers, etc. And out in the community, you have your GP and district nurses. After about 6 months of your diagnosis, your GP should call you in for a double appointment. This is called your cancer care review. This is so your GP can learn about what treatment you've had and how you've been managing it. They will be getting lots of information and letters from us telling them about what treatment you've had and what's to be expected in the future. So it's very important that you have this appointment. If you've not heard in about 6 months' time, then I would give your GP practice a ring and ask them when they're going to do their cancer care review appointment with you. Macmillan have built up partnerships with companies like Boots and Lloyds Banking to help patients with cancer. Some Boots have information pharmacists or number 7 beauty therapists who've had extra training from Macmillan. They will wear a little Macmillan badge so you know they're there to support you. Also, the Lloyds Banking Group, covering Lloyds, Halifax and Bank of Scotland, have worked with Macmillan to be able to give advice to people about finance. We're very proud of this film that we've made with a couple of our patients, Mairead and Sarah. They wanted to give something back to the hospital after having received treatment here. So a couple of years ago we made this film with our medical photography department about getting to know the oncology outpatients department. It's filmed with Mairead and Sarah walking you through the department, using their own words and giving you tips from their experience. We're very proud of it, and it did win an award in 2017. We know nowhere else who's made a film for patients by patients. But please be aware that this was made pre-COVID and pre-social distancing guidelines. We have a link in the booklet for you. You can find it on our Trust website and on YouTube.
Thank you for watching our video today. Please take some time to make notes on what you've heard and bring any questions that you have to your video consultation. Please be aware that all our advice is pre-COVID pandemic, and there may be more specific advice available to you on the government website. If you haven't booked an appointment for the video consultation yet, then please email us at the address on the screen, and we look forward to meeting you all there. Thank you.